Fevers are extremely common in all children and infants, and as a caregiver or parent, you should be familiar and comfortable with a fever, know what it is, and know how to treat it. Let's start by talking about what exactly a fever is. A fever is your body's immune response to a foreign invader. This might be a bacteria, but more commonly, it'll be a virus. When your body feels that a virus or bacteria has entered it, it will do a number of things to try to get rid of that foreign entity. And one of the things is to raise the body temperature to make it uncomfortable for that virus or for the bacteria. A fever is defined as over 100.4 Fahrenheit or over 38.2 Celsius. There are a number of different ways that you can check your child's fever, and we're going to talk about that right now. The best way to check your child's fever depends on what age they are. Let's start with an infant. The best way to check an infant's fever is similar to how you would change their diaper, and that's by checking their rectal fever. Have them lay down on their back and hold their legs up with one hand, just as you would when you're cleaning their bottom when you're changing the diaper. When they're in that position, put some Vaseline on the tip of the thermometer and gently insert it into the rectum, holding it there until it beeps. If you have a child a little bit older, maybe half a year or a year, the best way to check their temperature is axillary. This means under the armpit. Hold their arm close to their side so they won't move it, and make sure that the thermometer touches skin on both sides and not a t-shirt or a piece of clothing by accident. Have the thermometer under the armpit and hold it there until it beeps. You can give the child a hug during this time or just hold them still and make sure that they don't raise their arm. The last way of checking the temperature is for older children who can cooperate and listen to instructions. And this is the way that most of us are familiar with, under the tongue. Holding a thermometer under the tongue is very effective, and it's very easy to do for older children, but younger children might have trouble with this. So those are the three main ways to check a child's temperature. Let's go over them really quickly. Number 1, for infants, take their rectal temperature. Number 2, for smaller children, take their axillary temperature under their armpit. And number 3, for older children, have them put the thermometer under their tongue. You may have heard that taking the temperature under the armpit is less accurate, and that's true. However, the difference between axillary and rectal temperature is less than 1 degree. Now, in some cases, this may be the difference between almost having a fever and having a low fever, but this is okay because the treatment for almost having a fever and having a low fever is not very different. What you have to look for are the signs that come along with a fever, and these are signs that we'll talk about in the next videos.